Spring is in the air. Welcome to the Urgent Care Association Solutions on Demand webinar brought to you by HealthTrack RX. Today we're going to talk about the role of rapid multiplex PCR to optimize clinical decision-making for outpatient infections in the urgent care. We're going to discuss cases today that are unique to spring and summer. Kids come home from spring break, we see an increase in STIs, and as temperatures heat up, traditionally there's an increase in urinary tract infections as well. I'm your moderator, Ben Favre. So to get through these cases today, we're fortunate to be joined by two experts in molecular infectious disease. First, we have Ali Prego, a clinician at Modern Pediatrics and also a medical science liaison at HealthTrack RX. We also have Dr. Stephen Goldberg, who's an urgent care practitioner at University of Louisville Health and is also the chief medical officer of HealthTrack RX. With that, let's go to our next case. And here we have a 22-year-old female that presents with a 5-day history of abnormal vaginal discharge, dysuria, and labial irritation. Her history is she's sexually active, new male partner within the past month, history of inconsistent condom use, history of past UTIs, physical exam, erythema, and mild swelling of the labia. Patient reports it's painful on palpation, no discrete lesion though. Watery clear discharge in the vaginal vault. Exam the cervix and anexa is unremarkable. Point of care testing was done and both came up negative. Ali, here's the classic, young girl in college, came back from spring break. A week later, things aren't going well for her. She's scared. What are your first thoughts in a case like this?
Like you said, Ben, this is a young female patient. She's probably anxious and she doesn't know what's causing her to feel this way. And she clearly has signs of a GU infection of some kind. She's got a lot of different symptoms. And I actually don't think the clinical picture is exactly straightforward. She's having some pain with urinations and she's had past UTIs. So does she have a UTI? Maybe, but she also had a negative urinalysis in-house. So I'm less suspicious for that. She's having vaginal discharge, so chlamydia, gonorrhea, trich, BV, the usual suspects. Or, another consideration is this HSV. She's having labial pain and redness, or is this something else entirely? So there's a lot of different pathogens floating in my head. So now I have to decide what's the best diagnostic tool that I have access to really nail down exactly what's causing her symptoms and her discomfort.
So let's look at that. What are the diagnostic options that you think through in a case like this? Because there are so many pathogens you need to be concerned about. It makes it challenging. You have bacteria and viral pathogens. Walk us through your thinking from a diagnostic standpoint.
So like our MGENT case earlier, molecular testing really would be the best way for me to get both fast and accurate results for the STIs and the vaginitis pathogens I'm thinking of. So that's high on my list, especially for the things I'm suspicious of. So her urinalysis was negative. So again, less suspicious for UTI right now. But while she doesn't have a genital lesion in this case, if she did, I would definitely consider a viral culture of that lesion. But keeping in mind that culture can take days to result. So it's not entirely ideal for this patient that wants, fast answers. But since I'm suspicious for HSV as the possible cause of her vaginal discharge, I would definitely consider molecular testing for her vaginal discharge, testing that discharge directly to look for HSV. So I would choose molecular over serology for HSV in this case because I don't have to worry about picking up a past HSV infection, since I'm only interested to see if she's having an active HSV infection now. So for me, molecular testing would still be the best option in this case.
Excellent. Thank you. As you think through this case, you get your results back. What would be your treatment plan and based on those results?
Again, we actually ended up doing a lot of testing for this patient because she, we had a lot of differentials floating in her head and she had quite a few symptoms. So again, in-house urine HCG and urinalysis were negative, less concern for UTI. She's not pregnant. For this patient, I actually did have access to a wet prep in-house. So I did it because, it was there, it was fast, and this patient wants answers, quick, she's anxious. Negative for BV and yeast. I actually was able to do a next day PCR vaginitis panel for this patient to look for STIs as well as HSV. And HSV-2 is actually what she ended up testing positive for. Presumption is that this herpes virus is causing all of her symptoms, including her vaginal discharge. This was actually a real patient of mine. I was a little surprised HSV was kind of the answer, since this is an uncommon cause of vaginal discharge. But I was glad I was able to get an answer so quickly with PCR, so I didn't have to delay her treatment. I was able to get her feeling better faster. And the good news is, there is suppressive treatment available for an outbreak of genital herpes. So I was able to get her on acyclovir, just a quick course of that fairly quickly.
Very good. Thank you, Allie. So Dr. Goldberg, HSV is another one of those infections that's increasingly prevalent in the community. Walk us through, from a population health perspective, what we know and what are the patients where we should suspect this pathogen most commonly.
Sure, Ben. And for our viewers, we list there a few key facts about the prevalence, transmission and diagnosis, the impact and prevention and management of herpes simplex virus, with HSV-2 being the primary gynecologic sexually transmitted pathogen. About 1 in 6 women aged 14 to 49 is infected with HSV-2. So it's really quite prevalent. It's higher prevalence in Black and Hispanic populations. Possibly that's due to disparities in access to healthcare. Women are, it seems, biologically more susceptible to HSV-2 transmission than men. So that is also a factor in risk. Now, for many patients, they are unaware they have been exposed. They are unaware that they carry it, and many cases remain undiagnosed, as it can be asymptomatic for a long, long time. Now, some people are burdened, unfortunately, with recurrent outbreaks and discomfort. And this can cause, as Allie described earlier, feelings of psychological distress and other. So again, the common theme about talking about sexual health is so critical. If someone is pregnant and they have an active genital herpes occurrence, you have to consider the delivery plan, because there's risk of neonatal transmission. And there's ongoing efforts that focus on education and prevention and reducing stigmata. So screening is critical, early diagnosis is critical. And that's an illustration of how, in this case, where HSV atypically was the cause of vaginitis, is a great case for multiplex PCR, where you can get a rapid diagnosis and rapid intervention to drive suppression of the symptoms. As part of our education effort through these webinars, we like to offer some kind of thoughts for the future. Although this was vaginitis and a vaginal discharge as the primary complaint of HSV, we're all aware that HSV, and in particular HSV-2, can present as a vaginal ulcer. So we wanted to quickly review a differential of ulcers. We break them out in 2 different types: painful genital lesions and painless genital lesions. So there's a list of painful ones, of which herpes simplex virus is listed. There are others that listed there, including chancroid and Behçet's disease, which is a blood vessel inflammation. And then there's a differential for painless genital lesions, including syphilis, lymphogranuloma venereum, granuloma inguinale, and genital warts.
Very good. Thank you, Dr. Goldberg. Great review. With that, we have our next audience survey question. Would you consider PCR testing for this patient? Allie, we're talking about the difficult conversations. This conversation is difficult for different reasons. It's a young girl, right? She's thinking about her future and stuff like that. Any tips on that kind of conversation?
Yeah, this is a tricky one, because with the HSV-2 diagnosis, I do have to inform her that while this is treatable, it's a lifelong infection that can come back up in the future. So this is something that a lot of people struggle with, and these are really hard conversations to have, and it's a hard diagnosis to give. But again, circling back to how I kind of navigate all my STI diagnosis conversations, is that this is common. Like, you are not alone. Although this is something that may come up again, there is treatment. This shouldn't impact your life in a significant way, that despite the stigma that comes with it. So I really try to emphasize that this is common. This is something people go through, and there is treatment available, just to, help with the anxiety of that conversation.
Yeah, the world isn't coming to an end.
Exactly.
Dr.
Yes.
Goldberg, it seems like our results are kind of showing that, yes, in combo with microscopy. What are your thoughts on that? And for a lot of the STI infections, PCR is the standard of care. Any other thoughts on the results we're seeing?
Well, Ben, to me, it suggests that our colleagues have a range of diagnostic testing that comes to mind and might have in the clinic. So if many are mentioned about microscopy, that certainly considers about point of care testing for urine. Some might have wet mount capability in their office that could assess for bacterial vaginosis, yeast, even also a microscopic review for trichomonas. So the way I'm reading this is folks have access to both types of testing and are considering all, which is a really good idea.
Excellent. Thank you both. This has been wonderful. Really appreciate y'all's insights. And thank you everyone for attending for the Urgent Care Association Solutions on Demand webinar brought to you by HealthTrack RX.